Hi, my name is Barbara Murphy. I'm a medical oncologist at Vanderbilt. I specialize in research and supportive care for head and neck cancer patients, and that's why we're bringing you this topic today, because this is a topic that is near and dear to my heart. Stretching, strengthening, and posture, critical elements of self-care for head and neck cancer survivors. I am joined today by Dawn Sanschagrin, who is a patient of mine, who is going to be giving you her personal experience with regards to the importance of stretching and strengthening as a head and neck cancer survivor. This presentation is going to be in 3 separate parts. The first part is going to be about 15 minutes, where I'm going to be using slides to educate you a little bit about the problems related to musculoskeletal health in the head and neck cancer patient population. Then Dawn is going to talk to you for about 15 minutes about her personal experience. The last half hour is going to be our live webinar, where you'll be able to participate with us, and I'm going to walk you through an exercise program that you can participate in, which will include posture work, a little bit of breath work, some exercises for stretching and for strengthening. So let's go ahead and begin with a little bit of background. Functional impairment in head and neck cancer. What do we mean? Well, we usually are talking about 3 different types of functional impairment. The first is general functional impairment. This refers to the ability to carry out day-to-day activities. And there are a number of effects that cancer and treatment have on the body that impair our ability to conduct our day-to-day activities. You're probably familiar with these. The first is cancer-associated fatigue. And in the cancer patient population, fatigue can be a problem long-term. Unlike fatigue in the general population, patients who have cancer-related fatigue will say that, hey, look, when they get a good night's sleep, it really doesn't help. Or they will say, I can do just so much, and then I hit a wall and I literally have to stop. The second thing that commonly affects general function is sarcopenia, which is a decrease in muscle mass and a decrease in muscle function. Very common in head and neck cancer patients. And what this results in is what we would consider generalized weakness. And I think many of you have had this, where you have said, you know, I just don't feel as strong as I used to be. Now, the second category of functional impairment is head and neck specific impairment. We think of those as swallowing impairment, impairment in voice and speech, airway compromise, and abnormalities in sensation. That would include things like hearing and vision. The third and final category of functional impairments is musculoskeletal impairment. And that is what we're going to be concentrating on for the rest of this presentation. Okay, what are the common musculoskeletal issues in head and neck cancer survivors? The 3 most common are going to be decreased range of motion in the neck, the shoulders, and the upper chest, trismus, which is decreased range of motion in the jaw, and the third are postural abnormalities. Now, why do head and neck cancer patients have musculoskeletal problems in the first place? Well, first of all, cancer can cause musculoskeletal problems. Cancers can directly invade and damage tissues, and this can lead to tissue function loss. Patients will often say, hey, look, the cancer was causing a problem with function. I couldn't turn my head, I couldn't open my jaw. Is that going to get better after my tumor is treated? And the answer depends on several factors. Most importantly, the degree to which the tissues have been damaged by the cancer itself. So if there's only a little bit of damage to the tissues by cancer, well, then you may get almost full recovery of tissue function. However, if the damage is severe, the tissues may not be able to recover, and function loss may be permanent. The second cause of function loss is surgery. When you are operated on, the surgeon will remove the cancer and will remove surrounding tissues. Removing that tissue may cause alteration of function. And the degree to which the function is altered depends on the amount of tissue removed, the site at which the tissue is removed, and the damage to or functional ability of the tissue that remains. All of that can contribute. The third cause of musculoskeletal problems is radiation. Radiation can damage structures that are within the radiation field. We call that the radiation port. And the degree of tissue damage from radiation is determined by a number of things, and that will include the amount of radiation, the size of the radiation field, that is how much tissue is radiated, and the dose of each treatment. Now, when we combine all three factors, and there are many patients who have musculoskeletal tissues that are affected by the cancer, the surgery, and radiation, we combine all of that, and that will determine the extent of function loss due to musculoskeletal problems. So when we are talking about radiation and surgery and tumor damage to tissues, what tissues are we talking about? Well, we're talking about soft tissues, that would be skin, muscle, and fat, lymphovascular structures, such as blood vessels and lymph vessels. We can also have an effect on nerves. We can have an effect on bone. But what we're really going to be talking about are the top two, soft tissues and the lymphovascular structures. Okay. So what is the type of damage that affects our soft tissues and the lymphovascular structures? Well, the first type of soft tissue damage is called fibrosis. Fibrosis is the formation of scar tissue. And I think most of us are familiar with scar tissue. It's hard. It creates tissue that is not mobile, that has lost elasticity. On the top right, you see a picture of a patient who has fibrosis. You can look at her left neck and you can see those tissues are very hard. And in this particular case, this patient has a lot of difficulty straightening her head because of the scar tissue. We can also get lymphedema, and I will bet a lot of you've had lymphedema. That is the accumulation of lymphatic fluid in the interstitial spaces that may progress to fibrofatty scar tissue. Well, what on earth does that mean? That means fluid escapes from the vascular system, the arteries and capillaries, goes into the tissues, and the lymph channels that drain all of that tissue out of your soft of the soft tissues is blocked and non-functional, so you get backup of fluid and swelling of the tissues. That is shown in the picture on the bottom right. And you can see that in the chin area and in the neck, there's red, swollen tissue, and that's lymphedema. Now, lymphedema doesn't just affect the soft tissues on the outside of the body, that the tissues we can see, what we call external lymphedema and fibrosis. So external is, your cheeks, your neck. It can also affect the structures on the inside, right? So your mouth and throat and your airway. This is a picture of internal lymphedema. That means it's the internal structures. And what you see on the left is this nice little structure right here. This is the epiglottis. You've all probably seen your epiglottis when your ENT doctors have scoped you. It's supposed to be nice and thin, just like this one. so that when you swallow, it can flap down over your airway, your larynx, cover it over, and protect you while you're swallowing. If we look at panel B, this is the exact same patient. That's their epiglottis, but their epiglottis is swollen. It has lymphedema. And you can imagine that epiglottis isn't going to be as effective as flopping over, flopping over the larynx to protect you, protect your airway when you swallow. This is a CT image of the neck, and I'm going to just orient you. This is the jawbone. This is the chin. This is the tissue right underneath the chin. This is what it looks like normal at baseline before any treatment. You have a little bit of fat tissue, and then you have the muscle. This is those same tissues after radiation. And you can see that there's swelling, and you can see these little white lines. That's all lymphedema and fibrofatty scar. And as most of you know, this is a common place for soft tissue swelling and firmness post-treatment in head and neck cancer patients. This is the exact same set of scans, except a different cut. And what we have here are the vertebrae. Here we have the airway, which is your larynx. And here we have the tissues in front of the neck. And you can see this area where the blue dots are. It's black. That's the color it's supposed to be, because it should be fat tissue without any scarring in it. And then post-treatment, we see all of this scar tissue. All of this kind of grayed tissue has lymphedema and fibrosis in it. So, does that cause any problems? Yes, it does. And in a study we did, we asked patients what the most common symptoms were they had from their lymphedema and fibrosis. And we broke it down into three main categories. The first were musculoskeletal. The second were due to internal problems involving the pharynx and the larynx. And then we also had some symptoms that were related to the general symptoms that patients had, what we call systemic, and then the psychosocial issues. So let's concentrate on this group of symptoms, which is musculoskeletal, because that's what we're talking about today. So patients frequently said that they felt uncomfortable, that their head and neck area felt uncomfortable, that the tissues felt tight, that the skin was firm or hard, that they experienced stiffness, that when they touched their neck or tissues in their neck or face, that they felt tenderness, and that all of this resulted in limitation in movement. And those were common problems experienced by a large percentage of head and neck cancer survivors. Now, so you have symptoms, but how is that actually going to impact on your function? So let's go back first to what we call the neurosensory symptoms, or the symptoms that reflect altered sensation. So we know patients with lymphedema and fibrosis may have pain or tenderness. They may have numbness and tingling. They may have stiffness or pressure. When you have this group of symptoms, oftentimes what happens is you don't want to do your exercises. You don't want to do anything that's actually going to make it worse. So patients will often limit their movement. And unfortunately, limiting movement to limit these sensations that are uncomfortable can actually make function long-term worse. And in addition, all of these symptoms impact quality of life. So aside from just the fact that these tissues are uncomfortable, what are the other functional impacts? Well, first of all, we talked about this before, but we're going to go into a little bit more detail. Decreased range of motion. So when the tissues are scarred or swollen, it is much more difficult to be able to use joints effectively. And there are a good number of joints in the jaw, neck, and shoulders, as well as the upper chest. So the jaw is obviously the joint that we use to open the mouth. It allows us to eat, swallow, speak, clean our teeth. All of those really important activities can be limited when we have decreased range of motion in the jaw. Neck movement. We move our necks all the time. It allows us to watch TV and then look down at our book or hold a conversation with multiple people at a table. It allows us to get in the car and drive and look over our shoulder so we can safely make sure that there is no one coming up to the left or the right and we're not going to cause an accident. Same thing for shoulders and upper chest. When you have decreased range of motion in the shoulders, you may not be able to lift your arms up to comb your hair. You may not be able to move your shoulders back so that you can put a jacket on. If you have decreased range of motion in your upper chest, it will affect your posture, it will affect your breathing, and may result in stoop postures that cause pain in the neck, shoulders, and back. All right. That's pretty profound. The second thing that is often altered is posture. Now, we know commonly as we age, particularly if you have degenerative disease of the spine, that patients increasingly hunch forward so that there is a curve in their spine, in the upper spine, that becomes more pronounced. And as you hunch forward, what we call kyphosis, the chin juts forward and the weight of the head is carried on the neck. We've all seen little old people who walk that way. But unfortunately, that's also common in head and neck cancer survivors. That tendency to hunch forward is worsened by the muscle loss that we talked about earlier and the weakness that we talked about earlier, which is related to the effects of treatment. So altered posture is something that we have to be very, very, very aware of as cancer survivors. The third is decreased pulmonary capacity. And what is decreased pulmonary capacity due to? Well, potential causes are posture issues, because as you hunch forward, you're collapsing the chest cavity and the lungs can't expand as well. And so this can be a really major issue. If you couple that with muscle weakness, which many head and neck cancer survivors experience, you can imagine your capacity to take a deep breath is decreased. This is particularly a problem in patients who have what we call COPD, or chronic obstructive pulmonary disease, an example of which would be emphysema. And for people who have problems like emphysema and who have really significant posture issues, it may be very difficult to recover from respiratory infections such as pneumonias. So it is absolutely clear that musculoskeletal impairment, as manifested by decreased range of motion, altered posture, and decreased pulmonary capacity, can really affect your overall health, as well as impacting quality of life due to these altered sensations. So, what can you do to minimize the long-term effects of head and neck cancer and its therapy on your musculoskeletal health? Well, you have to establish a program of self-care. And the first thing to recognize is that self-care for anyone is a lifelong commitment. But in head and neck cancer survivors, it is a long-term commitment to managing the late effects of head and neck cancer and its therapy. And that includes mental health and nutrition and swallowing and oral health and smoking cessation with lung cancer screening for smokers and former smokers. But from the standpoint of musculoskeletal health, that means if you have lymphedema, you need to do lymphedema self-management. And that means for everyone, what I call rehab plus. Okay, that means, we always think about rehab as being a very short-term process. When I say rehab plus, I mean that you have to do this for life. So that means cardiovascular exercises so that you can not be fatigued to the point where you can't do the things you need to do, and you have good aerobic capacity. You need to do stretching and strengthening so that you can limit the decrease in range of motion that we see in so many of our patients, and so that you can maintain proper posture. You also need to do balance work, and you also need to do breath work, because breath work will help with the pulmonary function. Breath work will help you with your posture, and believe it or not, it can also help you with the stretching and help treat lymphedema. So we're going to end. I just want you to now just take a moment to breathe in deeply, and then hold your breath for a count of 3. Exhale slowly. And as you do, I just want you to release any built-up tension. And now repeat. A nice deep breath. Hold for 3. And exhale slowly. And as you exhale, I'm going to move you on to my co-presenter, Dawn, who's going to talk about her personal experience with exercise and stretching and working through the musculoskeletal problems faced by head and neck cancer patients. Thank you.
Hello, everyone. First, I would like to give a huge and heartfelt thank you to Vanderbilt and everyone associated with coordinating this event, especially in the midst of COVID-19. Thank you for this opportunity. I don't have enough words to express my gratitude to my Vanderbilt team of physicians, to include Dr. Matthew Miller, my primary care physician, Dr. Barbara Murphy, my medical oncologist, Dr. James Netterville, my surgeon, and Dr. Anthony Smellick, my oncology radiologist. These people are my family. And I can't stress enough how critically important it is to find a medical team that you truly trust. My doctors, as I said, have become my family, and I know in my heart, my healing was not only my success, but they celebrated it just as well and just as big and hearty as I did. You know, it was not just because they're experts in their field, but because they celebrated both my small and my big successes. It motivated me. It motivated me to want them to be proud of me. And when I went into their office and they said, Dawn, you need to do this type of exercise, I wanted to come back and I wanted them to brag on me like a small child, because that was an accomplishment. And you need a lot of small steps when you are being treated for cancer. You know, I remember when I received my cancer diagnosis, right? I mean, who doesn't remember the day that you wish for time to go backwards in your life before you ever heard those words? It's like time stands still, and it stops you in your tracks, but you feel like as though you're in a fog and the rest of the world is moving rapidly around you. I remember a voicemail left by my surgeon's nurse, Georgie, as I was trying to get an appointment scheduled, and she was so reassuring that I still have that message to this day on my answering machine. I can't tell you how many times I replayed it, absorbing all the strength and courage I could muster up from her compassionate voice. You know, you find yourself in a fight or flight crossroads. What am I going to do? Do I just sit here and fold my hands and let be what will be will be? Or do I get myself together and fight this dreaded disease? People can support you in many ways. They can even be by your side 24/7. However, only you can determine how you will react to your diagnosis, your treatment, and your continued recovery. I was thinking I'm the only one in my head. Thoughts were whipping around in my head at the speed of a NASCAR. And I couldn't crawl in my shell and pretend it wasn't happening. If ever something forces you to face reality, it is cancer. It's a club that you never want to be a member of, but we just don't have that choice. I don't feel like I'm qualified to give advice because people respond to things differently. But I would tell anyone and everyone not to go overboard in trying to research this on the internet for yourself. There's a monumental amount of good information that's accurate, but there's also as much and more that is not accurate, and it's not applicable to you and your situation. Do enough of your research so that you feel knowledgeable of your condition, but a large portion of that's going to come from your medical team. Ask questions, don't be shy. This is your life we're talking about, and you only have one of those on this earth. You know, my sister and I carried a notebook to all of my appointments in order to ask any prepared questions and record any answers. You know, I might say at this point too, my sister went with me to every one of my appointments, and she still does. So I guess, yes, you can tell she's the older and protective sister. Accept support and love from your family and your friends. I don't know what I would have done had it not been for the support of my mother, my sister, additional family members, friends, and my work colleagues. If you don't have a support network, please find one. There are various support groups in which you can participate. If you're feeling alone because you don't have a significant other, or perhaps you do not have children, make a connection with someone in order to have accountability. Some patients are motivated to tackle their illness and do everything they can to get better because of other people in their lives. They feel a certain accountability and responsibility to be the very best for others. If you can't find that accountability in yourself, find a friend. One of the hardest things I had to deal with was telling my family, my friends, my work family of my diagnosis. I didn't want them to worry, nor do you want to feel as though people are feeling sorry for you. The sooner you decide that you are not going to be defined by your cancer, the better. I'm so very proud to be a cancer survivor. I'm proud of that fact. Cancer has changed me on the inside and the outside. I have physical reminders and visual scarring that I refer to as my permanent tattoo. This reminds me of how God has been with me through this journey and continues to be. I remember the first time a child was staring at me while I was in the store. She was so focused on my neck and how it looked so different from others. And I realized it's all right because this is my new normal. I can tell you that my surgeon wasted no time in referring me to the team of doctors he wanted working towards attacking this disease. Honestly, my appointments were scheduled so quickly, it unnerved me. However, I soon learned that the quicker we had a plan of action or a game plan, that equated to me being able to fight something that I felt powerless to prevent. I made the decision that I feel is responsible for me to be able to sit here today and tell you my story. Obviously, I am a Christian, so this is where I knew I had to place my faith in a power much higher than myself, something much higher than myself. Faith is such a small word, but a difficult thing sometimes to feel and apply in your life. As I studied God's word and lifted prayers, I began to find more peace, and as hard as it might be to believe, even joy from time to time. My doctors knew I was looking first to my God to restore my health, but I knew he was using their wisdom as tools to administer to my health needs. They respected my choice to do so and supported me in my faith. My cancer was discovered in June of 2014. I started chemotherapy in July. I went one time a week for 9 weeks. I'll never forget the tote bag that my sister always carried, and she hung it on the hook on the door in the chemo room. She put it where I could always read it, and it said, "I can do all things through Christ who strengthens me," Philippians 4:13. I have absolutely no idea how many times I gazed on that bag and read that Bible verse over and over. I now have that tote bag. She gave it to me. I also have a cross at my work with that inscription. I began radiation treatments at the end of September for a total of 33 days, weekends off, yay, along with one chemo each week until the completion of my rounds at the end of October. Now what? What do I do now? In order to regain as much of my life as I knew it pre-cancer, I decided it was time for me to put in the work. After completing home health patient therapy, I started going to outpatient therapy performed by professionals certified in lymphedema and continued for 6 months, 2 times a week, seeing a swallowing specialist. I learned exercises to help my swallowing. I had exercises in which I performed for my jaw, my neck, and my head for better movement. I use resistant bands for my shoulders, and I also use a device called a TheraBite in order to open my mouth wider. Before I got that instrument, I took ice cream sticks and built them up a little bit more every day to get that mouth to open wider and wider. It is so important to maintain your dental health during your treatment and afterwards. You must remember to take care of your oral health. You know, I realize my life is different, and this is my new normal, as I said, and it's completely up to me to continue to exercise and physically do everything I possibly can to help myself. I must incorporate exercise, whether I schedule it as an activity or it's impromptu. I'm sure I've gotten some funny looks before sitting in my car doing exercises, making some really ugly faces, but I knew what I was doing. I took comfort in it and maybe even a little laughter to go along with it. So accept your new norm It's okay to compare yourselves to others to get the proper perspective. I know I certainly don't have to look very far to see someone who's gone through so much more than I have. If you have guilt for regaining your health while watching others struggle, it's natural and it's okay. Just don't linger there. Move on. Who am I? I can tell you who I'm not. I am not defined, nor am I submissive to cancer. I am very proud to be here today, to be able to share my story. And even though cancer has changed me on the outside, but even more on the inside, but it's been in a good way. You know what they say, don't sweat the small stuff. Man, I try to apply that every single day, sometimes more successfully than others. I pray and I wish the best for all of you. And now I'm going to turn it back over to my doctor, Dr. Barbara Murphy.
Thank you, Dawn. That was marvelous, and your heart comes out, which I love. We are now going to turn to our live session, so please join us as we get ready to do a practice with all of you and with us in a different room. Thank you.